Hello, this is Steve Heisman from Great Lakes EMS Academy and Dorsey College. And this is how to be successful at the National Registry. This is born out of a slideshow that we've been using at the Academy for the last 8 or 10 years called How to Be Successful as a Paramedic Student. And we're basically going to talk about studying and taking tests. To begin with, I'm going to quote Dale Carnegie with, "Only the prepared speaker deserves to be confident." I think that's fairly important to understand that it applies to being a paramedic student also. The National Registry test is a difficult test. Pretty much everyone says that. It is a computer adaptive, so if you're getting questions right, it's going to ask you more difficult questions. And pretty much everybody finds that to be a bit of a challenge. Uh, for you to do well on that test, you need to put the time in. You need to study. You need to go to class. You need to pay attention while you're there. You need to practice, practice, practice. Get through all of the psychomotor testing and do your clinicals to get some experience. In the absence of that, you're not going to have confidence, and the National Registry is going to go poorly for you. Another thing that Dale Carnegie said is fear does not exist anywhere except in the mind. And if you let fear start to encroach on your mind while you're trying to take tests, you'll see that things don't go well again. So the first thing is first. You need to spend some time and put effort in to being a good paramedic. We all have experienced high school classes, and some of us have some college courses where we, at least early on in college or some of the elective college courses, we've had instructors or professors that were only held to be responsible for teaching us at a comprehension level, which is a simple understanding of material. So at the end of the class, we would have had a summative exam that tested us at a comprehension level. Paramedic training isn't like that. Paramedic training is going to teach you and test you at a higher level, or you might say a deeper level of understanding. So I mentioned Bloom's taxonomy, and I think as students, it's a good idea for us to understand some of this adult learning stuff. Bloom has been well accepted, I would say, since the 50s, his theories on how we learn and understand material. So this works for pedagogy, which is children, and andragogy, which is adult learners. And when we first learn stuff, we should learn that at a knowledge or comprehension level. And then we go beyond that to understand material at an application level. And if we continue to use that information and have some experience, have a little bit more deeper knowledge, we will be able to use that information at an analysis or synthesis level. The National Registry writes all of their questions at an application or analysis level. So if you're not used to answering questions that are difficult like that, you're going to do poorly on the National Registry. So you've heard, I'm sure, the National Registry is hard, and the reason for that is a lot of people are used to comprehension questions. That's again where you'll see high schools and early college. That's all they have to be at. And EMS training, it does make sense. All of the information that you're going to know or see in class, you're going to have to know at a deeper level, and you're going to have to retain that information for your whole career. You're going to learn stuff in the first few days of class that is going to be testable at the very end of class, which is maybe 18 months away. So this isn't something that you can cram for. This isn't something that you are going to remember for a little while, do well on a test, and then let escape your brain for a long period of time. So first, understand that what might have been successful in high school may not be so successful in EM. So a good way to stay at that application level or get to the analysis level is to always ask why. All right. If you don't understand something, a great way to begin your question with your instructor is why. Why is it this way? Why is it that way? Why would the vitals be this way? Why would there be a rash? Why would there be this? Why would there be edema? Why would the blood pressure be low? Why would they lose their sight? Why would they do this? Why is Cushing's Cushing's? Why is Addison's Addison's? If you understand why, you will understand things. I guess I could go a little further, and you participate in simulations and scenarios and have some clinical background, you will easily be at the application level, all right, and be at the early analysis level. So let's finally start talking about studying. Um, Usually at this point, with a class full of students, I ask what are some tricks of the trade that people have used to do well in school? What are their study habits? And I get the same information or points from students pretty much all of the time now. People will talk about taking good notes and redoing their notes. A lot of people like study groups. Um, Other things are scheduling out your studying time. And lastly, people will talk about flashcards and such. So for me, there are some things that are true for pretty much everybody. All right. Uh, Things that are, some people can study here and some people can study there. But what is important is for you to figure out what works for you. And these things are probably going to help work for you. You just need to fine tune them a little bit. So the first thing is you need to figure out when you're going to study. And I would say early on, you want to ask yourself, what are you going to put 100% into in your life? Right now, you're embarking on a career in EMS. You probably want to be a good paramedic. I am hoping that that is your ambition. And like right now, what you should be asking yourself is, in my short life of 78, 80 years, what am I ever going to put 100% into? What am I really going to strive to be the best at? And I'm hoping that you would put paramedic class as one of those things. This is going to be the beginning of your career. This is where you'll establish your reputation. The foundation that you get as a paramedic student is important for you to build on with your experience as a paramedic. So, number one, we got to prioritize this and make sure that your strategy of being a good student is going to work. So a big part of that is scheduling out your when you're going to study. Find a place that could be in your home. It could be at a coffee shop, and I even have a picture of a bar there behind us. I don't mind people studying at bars. You just can't drink too much. You want to find some place that's either free of interruptions and distractions or has a manageable amount of interruptions and distractions. Some people study really well with a little bustle behind them. I personally like to study with a quiet television that I can reflect to when I want to. You need to have a big, large desk or area that you can set all your stuff out. And so you should probably have a binder that has your notes in it. a bunch of handout kind of material. Your computer is probably going to be a big part of it, and your textbook. I'll probably talk about this again later, but a lot of people start out class thinking a digital textbook is going to be okay, and I would tell you go onto Amazon or wherever and get a paramedic textbook. It doesn't even have to be the one that your teacher is using. It should be, but it doesn't have to. You want to be able to have something there that you can refer to, read about very easily, have it available to you, and just an immediate thing to go to. Or sometimes trying to Google it and such, it just takes a little bit longer than finding it on a page that you've referred to a couple of times before. So find a place where you're comfortable. Comfortable chair, comfortable desk, everything should be good to go for you. And then schedule it out to where that's what you're going to be doing and everybody knows it. Another thing that I think has been known for years and years, has been getting a lot of good research lately, and that is sleep. You need to get your sleep. Make that a priority. Scientists are now finding out that for the synapses that we're trying to put together for our little bits of knowledge to be retrieved later, that filing cabinet to be legitimate, is you need some sleep. The process that needs to happen for those things to be easily, what would you say, retrievable later on when you're taking a test is cemented basically when you're sleeping. So get plenty of sleep somehow. It's easy to say, hard to do, but try and schedule it and understand that getting plenty of sleep is helping your studying. So success is just ahead. What I want you to accept right now is whenever you're done with this program, usually that's around 18 months or so, you're going to be a paramedic. The time to start acting like a paramedic is right now. Your reputation starts when you're a paramedic student. So prioritize it. Put things first. First things first in your life. What's most important? What's second? What's third? And keep those three things. That's where you should be spending your time. Don't waste time. You know, how important are video games? How important is social media? How important is the news? Whatever it would be, you need to really structure your life in a prioritized way. I'm not saying that paramedic class has to be number one. Family, friends, your job are all important, but this should be in the top three, and put it ahead of some of the things that you may have prioritized in your life up till now. So plan out your study times. When you're planning those out, for me, like I went to school a while ago, and when I needed to study, I said, all right, Sunday morning, Sunday afternoon, Sunday night, those are all times that with some flexibility, I need to set aside for studying. Another time was, I think it was Thursday evening. Those 2 points were the times that I told my friends and family, give me a break. I need to have this time to study. And I didn't appreciate it when they asked me to go out or needed me to do something during those times. Because if they were all going to have fun, that is something that would be in the back of my brain and actually have an ill effect on my ability to study. So tell everybody, this is what I'm doing. Please, for the next 18 months, give me some time, give me some space. So you need to get that planned out. Sit down with a calendar, think about when you work, when you play, and when you study. So an important part here is some people will set up expectations of, I'm going to study 4 hours in a row from 6 to 10 period. It'll be completely all studying 4 hours a week. That's all I need. That might be setting you up for some failure. You need to study in shorter increments. So a 4 hour block of time is okay, but in that 4 hour block of time, hold yourself to 3 hours worth of studying. All right, so otherwise you'll be studying for about 30 minutes at a time and then taking a break. And the break is basically just getting up and doing something outside of studying. It could be maybe watching a YouTube video that has a little bit of an entertainment side to it, but maybe going over the same material like a pneumothorax or whatever. Let's talk about some A&P now. Let's get into the brain a little bit and talk about memory. So here is a picture of the brain, the limbic system, which is super primal. This is where our emotion and behavior, our motivation all is. These are the central nervous system transmitters like dopamine and serotonin and norepinephrine are all in here. We're going to talk about the hypothalamus just briefly. That's basically, as an EMT, you may have learned that it's where we have our temperature regulation. It's also the switchboard for the brain. All of the information that comes up to the brain goes through the hypothalamus. The hypothalamus says, all right, you go over here, you go over there. And then the hippocampus. And the hippocampus is an important part of this. The hippocampus is going to basically be part of that switchboard kind of thought process where it will send some information to long-term memory and others to short-term memory. All right. It's also going to be a big part of your emotion. So what we need to do is kind of control that emotion. While we're studying, we need to stay positive and kind of pay attention to how we're retaining information. We've all read a book, and while we're reading the book, maybe have some other thoughts enter our mind, and then when we're turning the page, we understand that, hey, I haven't been paying attention at all to what I'm reading. I'm paying more attention to, I don't know, how Michigan football is doing. So it's important for you to pay attention to that. Don't waste your time studying, all right? Study in an effective way. And one part of that is when you see that your hippocampus isn't engaged and putting stuff into long-term memory, stop studying. Do something else for maybe 5 to 10 minutes and then re-engage later and realize that when you're reading this material in a way that you're putting that into the temporal lobe or into a long-term memory, that's actually studying. This is kind of associated with the way people will teach people to learn someone's name. When somebody tells you their name, it's very easy to remember it for a short period of time and then for it to be gone the next time you see that person's face. The tricks to remember that name is to immediately use it in conversation, use it in your brain if you have to, and make up whatever, a story behind that, or compare that person to another person or to another thing using their name in a sentence that you don't have to say out loud. That helps you store things. It helps your hippocampus say, oh, I see what you're saying. You're wanting to put this into long-term storage, so let me help you with that. It's important for us to understand that we can control that. And if we're not controlling it, we can at least understand, oops, guess what? I'm wasting my time. I'm not understanding what I'm reading. So let's stop. Let's not get frustrated. Let's just stop. Go do something else for a short period of time, re-engage, and we'll be good. Here I also pointed out the amygdala at the tip of the hippocampus, and the amygdala is our fear center. So we might have heard that a little bit too, and the fear center is one that we want to think about also, because when we all of a sudden have engaged that fear center, we're going to get stimuli that's going to cause us to be a little bit more on the adrenaline side of emotion, and we're going to do poorly when we're taking a test. All right, so, and the last thing to think about is, again, sleep studies show that for us to have good long-term storage, we need to sleep. All right, you need to sleep. And so there's a little bit that temporal storage, and the frontal lobe is where we get short-term memory. So we need to understand, and this is, I think, the first time I'm asking you, you have to believe me. Um, we, as humans, have the ability to control this, all right? When you're thinking about spy movies, we might have seen that a spy could pick up little details in a room and be able to remember that stuff. The same thing about helicopter pilots. They're able to pick up, look at gauges in a short period of time, understand what that means, and apply then maybe collective or whatever it would be to make a change. This is true about the special operations community, like Navy SEALs and things of that sort too, where we understand that we can control our amygdala, we can control our hypothalamus. It just takes some understanding that we can control it first, and then when we see that we're starting to not concentrate, that we're with that maybe our pulse is up, that we're a little jittery, that we're starting to feel upset about something, that boom, that's when we have to stop studying, or that's when we have to stop answering questions. Do a little bit of box breathing, which I'll talk about later, and then re-engage our studying or our test taking. So here we got a, upset driver, and what nervous system do we know kicks in when we're mad? Same thing, same nervous system kicks in when we're in compensated shock, as we learned as an EMT. And that, of course, is the sympathetic nervous system. And the sympathetic nervous system is definitely going to have some effect on our body. And we learned those as an EMT. We know that our vitals are all going to go up. Our pupils are going to dilate. Skin is going to be pale, cool, diaphoretic. And we'll get a little bit of glucose in the release of glucocorticoids. So our glucose levels will come up. Our muscles will still get a lot of blood, but and our brain, our heart and lungs will all get a bunch of blood, but our small muscles are not going to get a lot of blood. So number one, we can control adrenaline. All right, we can control that. If we are finding ourselves like oops, guess what? We missed it. We now have a little bit of adrenaline loss because we got angry about thinking about this. We were upset because we didn't understand what this page said. We had a very difficult question, and all of a sudden we're starting to get a little bit of emotional about it. Well, we can control that. All right. And the one thing that we don't really often talk about with the sympathetic tone is with that we get adrenaline, and adrenaline makes you stupid. All right, you accept that. Adrenaline is to make us more primal, so we're not as logical. Another way to say that is we're dumber. Here, Yoda says adrenaline basically makes you stupid. All right, so when we're getting adrenaline releases, when we're studying, we stop studying because we're just wasting our time. All right, and when we're taking a test, we stop taking the test because we're going to get questions wrong. We've all answered questions on tests, and then when we're done with the test, we look back and we say, oh my gosh, why did I get that wrong? Very often it can be attributed to you no longer following rules that you know. Rules that you know are like read all of the question and read all of the answers and then pick the best answer. You know that's the trick. You know that's what you have to do. But once you start answering a couple of questions wrong, or you get upset about a question, only in a small way, not that you're crying or anything, but you're kind of knocked down your confidence a little bit. That gives you a little bit of adrenaline, and then you start doing dumb stuff and answering questions incorrectly. So we have to understand that. So here, let's talk a little bit more about studying tips, all right, how to be successful. One thing that I'll say is YouTube is awesome. I would like your instructor to find the YouTube videos that they think are most helpful and then send you links, but that doesn't always happen. You don't need them. You can go to YouTube and watch YouTube videos, and sometimes those videos are not going to be that good. When you're starting to see some information that doesn't sound like it's jiving with what you learned in class or what you learned in your book, that's awesome questions to ask your instructor, or get on that Google machine and figure out what's going on, what is true. For YouTube videos, I think that there's two, maybe three different categories. I really like all of them. There's like the 5-minute video, which is really good for kind of a break and to get something. And very often the 5-minute ones can be a little bit entertaining too. And then there are 15-minute ones, which again isn't too big of a time commitment and usually have some really good information. And then there's hour-long ones. And the hour-long ones are a bit hard to take usually. They're usually just an instructor recording themselves, just like I am here, and you're going to watch that over a long period of time, just like you are here. So those have some value, but it'd be great to break them up a little bit. So YouTube, all of the time, it should be a big part of your studying is taking some of the concepts that you feel that you don't know that well and just Google emphysema, Google COPD, diabetes, whatever it would be. Put that in the search engine on YouTube and you should be good to go. So review your notes before beginning an assignment. Another way to say that is before going to class. So when you're reading, you should read in a way that you've taken notes, and I'll get into that a little bit more. Eliminate your distractions at study time. I mentioned that before. Ask your friends and family not to bother you. Call other students. All right. If you can study with another person, that's as good of a piece of advice as it is working out with another person, because you motivate each other. Very often one person will understand something better than the other and they can explain it. You can ask each other questions, you can run scenarios, all kinds of different things. It ends up being, if you can put together a group of 4 or 5 people, and then sometimes study with 2 people and sometimes study with a whole group, and you're able to stay focused, that is a great key to success there. So review your schoolwork over the weekends. Don't let it go for too long in between. I'm kind of going off from the idea that very often classes are taught either on Monday, Wednesday, or Tuesday, Thursday, and don't let too much time go in between. Bring notes to clinical, bring notes to work, and have things that you can go over with all of the time, and make sure that one of your study times is probably on a Saturday, Sunday. It only has to be 2 hours. And then use more than one textbook. It doesn't have to be a current textbook either. The old textbooks are fine. You can get a 10 or 15-year-old textbook, bump one of those off from Amazon for pretty cheap, and it gives you another perspective, and it has a lot of value. Use your primary textbook and a secondary textbook. It's good information. As far as taking notes, there's 2 different times to take notes, not just in class. All right, so first, a good idea is while you're reading, take notes. It causes you to read deeper. All right, so take notes from your reading. If you're clicking through lectures on, like, say, JB Learning, take notes on those too. They don't have to be, all-inclusive. Don't just rewrite slides, but write what's most important, and then also in there, maybe using different colors, write questions for your instructor. So pretty much every time I've taught this, presented this to an audience, people talk about how important note-taking is. If you go to college, there's usually an early class that you're supposed to take on how to be a good student, and they will give you probably around 4 hours of material on how to take good notes. So um, everybody takes notes differently, but you should be taking notes. It's a way that you stay engaged. Don't just passively listen to your instructor. Write some stuff down. All right, write some stuff down. That's probably going to be chicken scratch when you are doing it in class, and maybe while you're doing that while you're reading, but then revisit those and make those nice notes, either typed up, or I don't like to type them up. Usually I just rewrite them, and that again is a way people learn. Spending time with your notes, making them nicer. And again, when we go back to studying with a friend, you can, when you're rewriting your notes, rewrite them in a way that you are going to write your notes and give them to your friend to study. And that engages your brain different, and you are going to understand stuff better when you're just rewriting those notes. So I mentioned a few times that you'd be reading a textbook and maybe taking notes from a textbook. And here's kind of an important question, and that is, how do you read a textbook? I am surprised how many people are flabbergasted at this question, and it seems like, well, I sometimes read it from beginning to end. I read it by the chapters. Some people will say, I like to read headings first, get a gist of what's going on, look at pictures, and then go back and read the chapter like a book, like a novel, you might say. And so what I would suggest to you is start using your textbook as a reference manual, and that is actually what it is. It's a reference manual. So most textbooks have the objectives printed on the first page of every chapter. They do that for a reason. The objectives are what's most important. Your teacher is probably going to be teaching from the objectives, and National Registry is going to test from those objectives. So the objectives are what's most important. A lot of authors are going to put in extra stuff, and some fluff, you might call it. And the fluff is fine. It's fun. It might be entertaining. It's cool, whatever you want to say. But if you don't have a lot of time, for me, I'm not that great at reading comprehension, so I don't like to read a whole bunch of stuff that I didn't need to read. I need to stay focused and pay attention to what I need to pay attention to. So in your textbook, what you want to do is first read the objectives. Read that first objective and say, do I know this content or not? Do I know what they're talking about? And if you do, you can put a little mark next to there that basically says, I know what this is. And then go to the next one and the next one and the next one. And what you'll be doing is figuring out where do you need to go and read? What do you need to read, and what don't you have to read? So this is what you'll end up with on your objectives page. You'll see I have a couple of different things there. One is if I read something like list the situations the paramedic is legally required to report, if I completely didn't know anything about that, I might just put a dash by the number 3 or nothing. And then I'd go read about it. You can see there it tells me that I would have to go to page 121 or 122. If I think I know this one, but I'm not sure, I would put a box around it, and then I would go read about it, and I would come back. And like number 4, it says describe the 4 elements. And I would think to myself, all right, what are the 4 elements? And I know them, 1, 2, 3, 4, done. I would put a box and an X, and that means I don't have to go see that objective anymore. And then number 5 is another box, and that one I might have to read about. And then number 9 there is a big question mark, and that one's the question mark shouldn't be there. It could be anywhere else. But that means that is like I'm gonna email my instructor about this, or I'm going to ask in class. I don't even understand here it would have been the legal complications related to consent, like how big a trouble could I get into? So By doing this, you're only going to read what you need to read, and you'll have better confidence that you understand what you need to understand. It kind of makes sense. So I'm going to wrap up the studying. All right. I'm thinking none of what I just told you is too earth-shattering. All right. You've probably heard the stuff before. Um, uh, Now, what you have to do is truly embrace it. All right. What I've said is important. If you're not doing these things, you're probably not going to learn things as deeply as you need to. So let's put some effort into this. I would say early on, uh, before you get really engaged into this class, um, figure out what in your life are you going to put 100% into. And if it's this, and I'm telling you it should be, then put 100% and feel what that feels like. So take control of your schedule and broadcast that to your loved ones. When in class, take notes and understand why. Those two things. Take good notes and understand why. And remember, when you're clicking through a lecture on, if that's the way your school goes, a hybrid class, well, then you're taking notes on that lecture also. All right? Take notes and understand why. So while you're clicking through there, have your note paper there and maybe different colored pens. And when you come across something that you think is a good question to ask your teacher, then ask, write it down and ask it. So read your textbook efficiently and do that by looking at what objectives you do know and what you don't know, and then go read about those objectives and stay away from everything else. If you don't want to do it, don't do it. All of the different graphs and pictures and fluff that an author would put in there might not help you that much. So use the resources that work for you. YouTube is one that works for me. Another textbook is another one that works. Other people in class, that works. So use what's good for you. Study in work groups if you can, and then pay attention to your brain. You can do this, all right? When your brain doesn't want to study, it's not studying. It controls you, all right? So you might as well not study. Go do something else. And you might have to re-engage at a different time that isn't on your set schedule. But you will get there, all right? All right, so we're done with studying and we're up to test taking strategies. And again, the first thing to think about when you're thinking about how to be successful at taking a test is you have to study. And it isn't just cramming. You have to put in time over a long period of time. We reap what we sow. All right. So confidence has a lot to do with your success. And you're not going to have any confidence if you know that you haven't been putting in the work. And you know, all right, you know more than your instructor, you know more than anybody else in the world. Have you been putting in the effort? So the next thing is visualize success. All right, so you're going to have to train your brain here. I say that phrase a lot in class. Um, and this is important, all right? So always stay on the side of success and being positive, all right? So visualize yourself being successful. Don't dwell on what happens if I fail, all right? Don't dwell on how hard it is. Don't dwell on your past if you've had failures in your past. Visualize you being successful, all right? And you can do that easily when you studied hard. When you put in all of the effort, you'll have some confidence there and you'll see yourself being successful. Um, to detract from there, one thing that you could ask is, what is the worst that could happen? All right, that's not visualizing success. I'm not a big fan of this point here, but what is the worst that could happen? And usually the worst that could happen is you'll have to take a retest. All right, but it isn't that bad. And you know what? If you really have been not paying attention, not going to class, not doing well, what is the worst that could happen? And usually that means that you might have to pay a little bit more in your tuition and you get reset. Um, let's go with 4 months behind. You know, you have to go back 4 months of class or even 6 months of class. In a big picture, that's nothing. All right, it isn't that big of a deal at all. So stop thinking this is life or death and causing yourself to have some adrenaline because you think this is so important. It's not going to be that bad. I know a lot of paramedics who failed one of our modules here, and they are successful and awesome paramedics now. So it isn't a end of the game kind of scenario when you do poorly on one test. So while you're taking a test, take your time. There isn't a real good reason for EMS to time you on your exams. And so 100-minute exam has 100 questions has 100 minutes. That doesn't make any sense. So the National Registry has a timing to it, but none of my students bump into that timing problem at all, because they usually have, I don't even know, maybe 180 minutes or so to take an 80 question test. All right, so most of my students are done in 80 questions, so they don't really care about that. And the other thing is, don't quit on yourself. While you're taking a test, a lot of times people will read a long item, which is like the question, part of the question. When they read that long item and they got maybe a little bit confused in there, they'll say, this is just too hard. I don't understand this. And they'll guess C, when in doubt, Charlie out, and then they move on to the next question. The problem with that, first, you got a question wrong, or you have a quarter of a chance of getting it right, but you probably got it wrong. The next question, your confidence isn't going to be where it is. And if you run into 2 bad questions in a row, now we're looking at maybe getting a little adrenaline, and you're going to get the 3rd question wrong too. So don't quit on yourself. If that was difficult, when you first read through the item, the trick is to maybe simplify the question as much as you can, take out only what's the most important part, read all of the answers first, and then go back and reread the question and see if you can figure it out. And very often you can. It just takes a little bit of time. To talk about the National Registry Testing Center a little bit, this is, it's a good thing to, what do we say, train for, right? So, because this is about the hardest, what would you say, the most adrenaline provoking testing scenario that you'll ever get, because it's kind of intimidated when you walk in there and they're fingerprinting you and they're making sure you don't have any extra stuff on you. And when people get that, you're getting your retina examined and all of this stuff, they get adrenaline. All right, they start to have that test taking anxiety. So first of all, when you get back to the computer after the strip search and you put all of your stuff in your locker, when you sit down at the computer, they'll give you a whiteboard and a felt pen, and then tell you you're on your own. All right, and the computer hasn't started the test yet. All right, you don't start until you click it to start. So just sit there for a little while. Check your pulse. All right, if your pulse is fast, if it's above 100, don't do anything. Just sit there. Think some good thoughts. You're only going to do this once, hopefully. So just sit around. You can look at other people, look around the room, see how everybody is doing. There's no cheating. It's not like you can cheat by looking at somebody else's computer screen. So you can look at other people's computer screen. It's not cheating. All right, you're just being a little annoying, I would guess, maybe to somebody else in the room. But don't start taking that test. Just relax. Do some box breathing, thinking some good thoughts, and you want to vanquish that adrenaline out of your body. Just keep checking your pulse and make sure that it's well below 100 before you start taking the test. Get it in the 60s or 70s. And then with that whiteboard, write out some cheat sheets. All right, and hopefully you learned some stuff in the class, how to write out cheat sheets For my classes, it would be things like the cranial nerves. There's a 12-lead EKG stuff that we write down. There is the acid-base matrix, all of that kind of stuff. You just write down and then start the test after you've relaxed. Here are some of those cheat sheets. You could do just the Glasgow Coma Scale. There's National Registry questions that ask you for the exact number for Glasgow Coma Scale as it's explained in the item. Think about AEIOU tips. That's an easy one. Acid-base matrix. Try and figure that out. There's some YouTube videos. And if you can write that out, you'll get the acid-base right. Some drug information might be useful for you. Some cranial nerves. Just write out the cranial nerves. There's cranial nerve questions on the National Registry. Write out your 12 leads, like where you're looking at the heart, what cranial nerve, what coronary artery feeds that area, and then maybe like what's the look of ischemia, what's the look of infarctine, what's the look of infarcted, and then maybe how do you tell a bundle branch block, or how do you do axis deviation? You can just write that stuff out. First of all, for these to work, you have to write it out a bunch. So when you're writing it out before the test, it's something that's easy for you to do. Rule of nines, Parkland formula, med math volume, equations just like the formula. Maybe an A&P picture where you like to draw these out and you know the kidneys better. Mnemonics that you might have thought of or heard that your instructor liked. And then acronyms that you used to memorize stuff. So all of those things, just write them out. And it should be, for the cheat sheets to work, writing out the cheat sheets should make you calm. So the only way to make you calm by doing this is you have to write these cheat sheets a bunch of times, 100 times, all right? It's something that you might have put on the back of your toilet and you just write it out whenever you go into the bathroom. It is in your passenger seat. So whenever you have a minute here or a minute there, you could write out the acid-base matrix, whatever it would be. But you can't like say to yourself, I hope I can do this when I get there. It's got to be something that's like riding a bike by the time you get there. When you actually push the button and now you're answering questions, you should be ready for scenario-based questions that ask for the priority of care. What would you do next? And some of them are like, what is your overall management? So you're going to need to know how to do a differential diagnosis and the keys for your clinical impression. What makes it CHF? What makes it COPD? What makes it pneumonia? What makes it meningitis? Whatever it would be, you need to know that stuff. And then what else? They're going to make it sound like it could be something else. So you have to figure out, like, what are they trying to say? Is this a CHF patient? And what do I do for a CHF patient? Is this a SVT patient? Okay, what do I do for a SVT patient? First, you need to know that. You got that from studying. If any part of one of the answers is wrong, that is the wrong answer. It's kind of an easy thing, right? So a lot of people like to pick that answer because it had some cool stuff in it that was all right, but then at the end it asked you to give this drug with maybe too little of the drug, or too much of the drug would be even worse. So always pick the answer that is all right, even though you might like the other one and it had a really cool stuff. But it had a little bit of wrong stuff. The little bit of wrong stuff makes it wrong. Remember, it's basics before advanced. So if sometimes the answer is give them manual airway, all right? And that's going to be way before make sure they're intubated, all right? Your safety and health are important. So there are safety and health questions there. Your employer wants you to stay healthy. So your employer has some say-so what's on the National Registry, and they place a high priority on you making the right decisions about med legally and your health. So think about that. A lot of times people want to study all of the other stuff that you've learned in paramedic class, but way back in chapters 2 and 3, that's some important information too. And so take your time, read the item, and maybe reread the item, and then read the answers and maybe reread the answers. You need to know you need to know the whole thing before you go on and answer that question. You have plenty of time. So here's a little activity that we can do. What I want you to do is just read this a second. The final exam. The finished files are the result of years of scientific study combined with the experience of many years. So finished files are the result of years of scientific study combined with experience of many years. All right, so let's go to the next. And so without looking back at the last slide, how many F's were on the previous slide? All right, how many F's? Uppercase and lowercase. How many F's were there when we count all of those up? You can take a little while to figure that out. It's a fairly difficult question, actually. You can think about that. It said scientific. I remember that one. And now, why this is important is the idea that sometimes it's good to know what the answer is. What are your choices of answers before you read the question? So if I asked you how many F's are on the next slide, it makes it a little bit easier. So here we are again, looking at the slide. It's kind of easy then to say, oh, there's this many F's on this slide. So how many think? What's your number going to be? Probably a little easier and more accurate than looking before. And again, the trick here is the idea so that sometimes when you read the question's answers, it makes that item a little bit easier to read because now you're knowing what you're looking for. And here's all those F's. Boom, 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 and boom. So yeah, hopefully you got that right. What is that? 7 F's. So when you're sitting there taking the test, here's my advice here. Go slow. When you're upset, stop. All right. When you think you've gotten a couple wrong or you're getting a little bit stressed, just stop taking the test. You don't have to worry about the timing. Read the question and the answers, and then go back and read the whole item. So read the question, and then all of those answers, and then reread that item. The item is actually the question. All right. And in this way, when you know what the answers are, when you're reading the question again, it will make more sense, like what are they looking for kind of thing. Now you will know what you're looking for, so the process of elimination goes a little bit easier. So here's a little bit about mental toughness. So you're wanting to be a paramedic, a career in EMS, you're going to need some mental toughness, all right? So as you are getting ready for your test, and remember, getting ready for your test isn't on Tuesday night for a Wednesday exam. This is now, maybe you're at the end of your paramedic training. Let's go with that since we're talking about National Registry. For months, all right? We're talking about the last few months of class is when you should be going back into the primary stuff that you learned way back in the preparatory phase of your training. And when you're going through those objectives in the book, or rereading the book, or re-engaging on online lectures, or just looking over your notes, when you're doing that, you should be looking at that and thinking about how you're going to be doing on the test, running through those steps, and saying to yourself, "Boom! I know how to do this." So this also has a bit to do with the psychomotor testing. All right, being able to run through all of the steps of static and dynamic testing, being able to do the 20-minute out of hospital, how you're going to do on the oral station, just running through those steps. Like, first I'm going to do a good assessment of the scene, and then I'm going to do a general impression of the patient. I'm going to ask all of these questions, and then I'm going to get into my history. I'm not going to run into getting into a clinical impression and going only with that clinical impression. I'm going to also talk about a differential diagnosis, and then I'm going to treat it appropriately because I know how to do that. I went through all the training. I'm going to be good at this. All right. So positive self-talk and goal setting. And then this last thing on the slide is arousal control, and that's box breathing is my advice to you. And box breathing is I like doing a 4 count. And what that is you are going to draw in a deep breath over 4 seconds. All right, so that's a big. And then you're going to hold your breath for 4 seconds. 1, 2, 3, 4. And then you're going to exhale for 4 seconds. And then you're just going to hold your breath for 4 seconds. This one's a hard one. And then you're going to, that second deep breath now is going to take 4 seconds. And this is one I always mess this one up. It's hard to do that over 4 seconds. You'll probably take a 2-second breath. And then you're going to hold it for 4 seconds. And you're going to blow out for 4 seconds. And you're going to hold it again for 4 seconds. So you will screw it up at the very beginning, but after about a minute, you'll be doing it well. And you only need to do this for a few minutes. We're talking about 3 or 4 minutes out of your life. And if you do the math quickly, then if you're doing 4-second box breathing, that means that you'll take 1 breath every 16 seconds, and you'll be breathing 4 times a minute. That gets rid of your adrenaline. It engages your parasympathetic nervous system. You will calm down. You'll feel it in your pulse. You'll feel it in your head, and you'll be ready to take the test. So when you start to feel arousal, go to box breathing. It works when you're shooting weapons. It works when you're going to go through a door. It should work while you're driving an ambulance and you're a little bit maybe excited about going to this shooting or car accident. Box breathing is a big part. A lot of times people talk about box breathing in the way that some athletes would use it after running or biking, swimming, whatever it would be. You don't want to do it then. That's not what I'm talking about. I'm talking about only arousal control. So the time that you want to do it is when you're feeling that, I'm having a little bit of problem with adrenaline. Arousal control. You will control that arousal by box breathing. Easiest way to do it. Very easy to do it. All right. And you don't have to worry about, you don't have to do it out loud. There's actually apps for your phone to do this if you want to get really good at it. You don't have to be perfect at it. But if you try it for a minute, usually 1 minute into it, you're doing fine. And the end goal in 2 or 3 minutes, you'll have calmed yourself. Okay, we're going to rehash some stuff here just a little bit. This mental rehearsal isn't just for nerds. All right, so I'm surprised how few students actually think about this and use this. All right, but mental rehearsal is something that will help. The very successful people support this. All kinds of different books and podcasts will cover this topic. So you can just Google this and find out more. Visualizing a step of a procedure, just boom, boom, this is how I'm going to start the IV, this is how I'm going to intubate, this is how I'm going to do this or that. That will help you, just constantly going over it and over it when you have time. And some of that would be maybe before you go into your testing while you're a paramedic student. So take your time, go through it, go through the testing sheet that you might have over and over and over again. Visualizing success, vanquish the thought of failure, and just keep on going over and over again. And you'll see it is very helpful. So here is Wonder Woman and Ann Cuddy, who did some study on just taking this pose. All right, it was, I believe at the very beginning, it was a Superman pose, and it ended up being, because Ann Cuddy is a female, she ended up calling it the Superwoman Pose. And what they did, and this is, if you want to learn more about it, you can just do Amy Cuddy. I think I said Ann Cuddy. Amy Cuddy, and her power pose. This is a 15-minute TED Talk, and she's a scientist. Her, along with others, have proven that there are different levels of your hormones, like cortisol, in your system just by taking this pose. That's it. Just taking the pose. Having some positive thoughts on top of that is going to help you control the hormones that might make you stupid. All right? These are ones that increased people's confidence. This is scientific. It was also done with people's views, like they said, I want you to stand like this and then go talk in a boardroom or do this and do that. And people said after standing like this, they had more confidence. And then they also drew blood levels and seen that they had better hormone levels that would cause them to be maybe more confident and more in control. So definitely something to look at. And you can trust me, or you can go watch Amy Cuddy, and there's several different videos. And there's more than her as far as scientists that are supportive of this. Okay, and then the arousal control, I think we've talked about enough. It is the way they teach Navy SEALs how to control their adrenaline flow, all right? If you engage your sympathetic nervous system, you're not going to have the fine motor control that you need or the sight that you need to be able to shoot distances, you're not going to have the accuracy that you want. So arousal control can be done. You don't have to be a Navy SEAL. All of us can do it, and it will help you vanquish the adrenaline, vanquish fear, and help you answer questions correctly, and maybe help you study appropriately.
All right, you arrive on scene. You have a 38-year-old male, chief complaint of not feeling well.
Okay. Hi, sir. How are you doing today? So what's going on?
Yeah, he says he hasn't been feeling well for a while now.
Okay, so what I'm going to do is I'm going to get...
Your patient's dead.
Wait, what? He's dead?
Your patient had a 3-foot katana sword sticking out of his back that you failed to find during your initial assessment.
Oh, come on. How am I supposed to find that?
Also, you're dead.
Wait, I'm dead?
Yep, there was a second victim in the house who's been huffing paint in a vacuum-sealed room for the last 2 days, and he stabbed you for the highlighter that you had in your pocket.
What?
I'll tell you what, new scenario. You arrive on scene, patient's in full respiratory arrest.
Okay, he's in respiratory arrest. I'm going to go ahead and grab my airway bag and intubate him.
Can't intubate him, there's an octopus on his face.
Okay, I'm gonna pull the octopus off.
The octopus has been trained in the art of anti-pulling. You can't get him off.
I'm gonna get my scalpel. I'm gonna get my scalpel and I'm gonna cut it off.
You can't get the scalpel out. Your partner has glued the airway bag shut.
Why would he do that?
It doesn't matter. What are you gonna do? You arrive on scene to a house with 6 vehicles in the driveway, a patient with a chief complaint of abnormal labs and just needing a ride to the hospital because it's faster via ambulance.
I'm gonna assist him into the ambulance and give him a ride to the hospital.
Great job. You passed.
Awesome. Being a medic's gonna be easy.
So here, a slide just about the National Registry Psychomotor. A lot of people worry that you're going to have something very difficult when you get to your 20-minute out of hospital or your oral stations. And in my experience, they're all really standard. All right. You need to know how to form a clinical impression and then how to do a differential diagnosis. What are all the things that you have to rule out? Try and come down with some standard things like sample for all of your history. We use TACOs, which is in the Jones and Bartlett EMT book, if you'd like to figure out what that is. OPQRST, any of the medical complaints for pain. All of those kind of things are like the standard that you'll be using and figuring out what is wrong with your patient. And you need to know how to treat them, which isn't going to be too difficult. All right. It won't be the ninja trained squid or something like that. So don't get too upset about it. Use those things like positive imagery and arousal control, and you'll be fine at the psychomotor. All right, we're wrapping things up finally. This is the last slide. We're over an hour now. So again, what I want you to do is take a moment and ask yourself, what is worth putting 100% effort into? All right. And I hope you think that it's paramedic class. You don't want to be a second-rate paramedic. That's not going to be good for anybody. Remember that you don't want to be a second-rate student either. And your reputation starts right here. All right. It starts now. Your cohort, all the other people in class are going to acknowledge, how well of a student you are, and that pretty much gives you your base that you'll build on with the experience of being a paramedic. So to be successful, what you need to do is talk to family and friends and make sure they know that this is important to you and that you're going to be studying from this time to that time, and you're not going to be available to do this or that. And then when you're successful, take them all out to the bar and buy them a beer for putting up with you and your inability to spend much time with them over the last 18 months. And that is it. If you have any questions, if you'd like to talk to me, my email is steve.huisman, Huisman, @gmail.com. And good luck.